Hello, my name is Courtney Spees. I'm doing the hyperthyroidism case study. So we have Mrs. Black. She's a 31-year-old female, and she's 2 weeks postpartum. Her husband brought her in because she was difficult to arouse and confused. So the first thing that I'm going to do is go ahead and walk into the room and do my cue, since I'm looking at the patient's position, looking how many eyebrows she has up, if she has her call light, if the bed is locked, if it's lowered, if she has any kind of tubes, drains, IVs, Foley, anything like that. If she's on oxygen, making sure that her pathways are clear and that her whiteboard is updated and with the correct date and correct providers. I'm also going to go ahead and ask her name and date of birth, and right now she's not responsive. So the way I would double check that is A, confirm with her husband, B, confirm with her medical bracelet, and then match that to her chart. So I'm going to go ahead and introduce myself, even though she's not responsive. So hi, my name's Courtney. I'll be your RN today. So the first thing I'm going to do is ask her name and birth date, which she can't tell me. She's not responsive. So I'm not really able to assess her level of consciousness, or not level of conscious, her orientation. So she is alerted with painful stimulus. So I went ahead and charted that. I just said unable to assess orientation, somnolent, and responsive to painful stimulus. So she's just kind of out of it right now. We're going to go ahead and do her Perla. Okay. And then I'm going to go ahead and turn her head to the side here. Check for JVD. The next thing I'm going to do is go ahead and look at her skin. It is warm, pink, and dry. Her skin is intact. I'm going to go ahead and, so since she's responsive to stimulus, I'm going to go ahead and push towards her and see if she'll just push back for me or move her fingers at all. Okay, that's positive. Push, pull. Since she grabbed my hand, she was able to grip. I know that she can move those extremities. I'm going to go ahead and check her radial pulses. Okay, they are rapid and irregular. I'm going to go ahead and check her cap refill. Alright, and then I'm looking for any edema, which I don't see any edema. Okay, I'm going to go ahead and take a listen to her. I'm going to ask her husband if she's been coughing lately. I'm going to go ahead and, while she's on her back, I'm going to listen to her apical heart rate. So S1 and S2 are present. It's rapid and irregular. I'm going to go ahead and have her turn on her side here. Okay, and then I'm going to have her turn back on her back. Doing a back 1C. Alright, so her lung sounds were increased, labored, and irregular, and she had some diffuse crackles noted bilaterally, anteriorly, and posteriorly. Next thing I'm going to do is go ahead and listen to her abdominal area. So the first thing I'm going to do is inspect the skin, making sure everything is intact. I'm going to go ahead and auscultate now. Okay, and then I'm going to go, woo, swinging that thing all over the place. Jeez Louise. Alright, I'm going to go ahead and palpate. Her husband said that she's been complaining of some abdominal pain, so her abdomen was soft, round, and tender. She's also been having some diarrhea, so I noted that in the chart. If she's been having painful urination at all, any discharge, no, okay. So the next thing I'm going to do is come down here. And like I said, I'm going to stimulate her and see if she wiggles her toes, pushes me, pulls me, anything like that. I'm going to go ahead and do her pedal pulses and then check her cap refill on every single toe. It's less than 3 seconds. I don't note any edema down here as well. I'm also going to be seeing if she's like withdrawing or anything like that, like if she's in pain. Looking for any paresthesia, if she can feel me down here, anything like that. I could even take my pen light and rub it on her legs and, you know, whole 9 yards right there. So, after we charted everything from that, we're going to go ahead and do some nursing intervention. So what I said I would do is monitor her vital signs and level of consciousness, and I'd be calling the provider to get some orders for medication and labs. I said that if she's having a hard time breathing or anything, then we can go ahead and turn her on the left side to recovery position to help stabilize her. I'd place her on continuous cardiac monitoring, and then I'm also going to be monitoring her fluid status. So I'm going to make sure that we're monitoring her INOs. I said we should order a thyroid function test, blood test, TSH measurement, thyroid scan treatment, and an EKG. Her labs came back. So I said that she is suffering from a thyroid storm. So the provider has prescribed Enderil, propanolol, 10 milligrams, IV push 3 times a day. And we're also going to be hanging 0.45 normal saline at 100 milliliters an hour for her. So the first thing that we're going to do is sorry, I'm just getting my thoughts together. Yeah, okay. So the first thing that we're going to do is, she already has a bag hung, actually. So what we're going to do is just, once again, check that order. And I'm also going to provide some patient education to her husband and her. So the propanolol is going to decrease our heart and BP. Some side effects are arrhythmias, bradycardia, some pulmonary edema. We're going to be monitoring her BP and pulse throughout the entire therapy. We're going to be monitoring her INO. And then we're going to monitor her heart rate and blood pressure closely after 2 hours. For 2 hours after each dose. So, and we're also going to push this over 10 minutes. So, some more education. He's asking what could have caused her to, what's causing this. So I said that severe medical stressors can trigger patients with hyperthyroidism. Well, she has Graves' disease. So I said since she recently had just given birth and been pregnant, that stressor to the body may have triggered the thyroid storm. Also, her TSH level was 0.1, which was very low, which had made her thyroid overcompensate and caused her to go to the other end of the spectrum, meaning that now she's producing too much. Her body's trying to overcompensate for that. And then in addition to already being diagnosed with Graves' disease, these factors most likely contributed to this. So the first thing I'm going to do also is confirm that she has no drug allergies. I'm going to check her chart. I'm going to go ahead and grab the Enderil and then the 0.45 normal saline bag. So I'm checking the orders. I already checked her allergies. I'm going to go ahead and chart which port, like which side I'm putting it in. So her left antecubital IV side I'm putting this in. So I've already checked the orders. I'm gonna check her name and birth date. And since she can't respond, like I said, I can confirm with her husband and then confirm the bracelet to the chart. I'm going to go ahead and prepare these meds now. So I don't actually have a bag of normal saline, so we're just going to pretend. So I already have that, and I'd label it, making sure everything's okay. So I'm going to push that to the side. I'd wash my hands and put some gloves on. So we're going to be giving 10 milligrams, so we'll just say that that's 2 milliliters. Let's say there's 5 milligrams and 1 milliliter. So the first thing I'm going to be doing is getting an alcohol prep pad. I'm going to have gloves on, obviously, and not drop the prep pad because, yeah. So we're going to be cleaning the vial off. We're going to be carefully uncapping this needle. We're going to inject or pull up as much air, so I'm going to pull up. Okay. And then we're going to carefully draw up this medication. So we're drawing it up. I'm going to take this out very easily, carefully, making sure we're being safe here. And then I'm going to push all the air bubbles out, flick, 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 flick. And then since we're doing this IV push, we do this needleless, so I would go ahead and put the safety on the needle, and I'm just going, or I can technically just recap it, I guess. So I'm going to recap that, buddy, and then I'm going to screw off the actual needle from the port. So now we have the med. So the next thing I'm going to do is come over here. I have my flush. I have some alcohol prep pads here. So the first thing I'm going to do is I need to check the patency of the IV, making sure I'm looking and assessing, making sure that the IV side isn't red or swollen or have pain or anything like that. I'm going to go ahead and flush the IV first. So I'd go ahead and attach this to the IV and flush it. Okay, so it's patent. So the first thing I'm going to do is go ahead and get my handy dandy prep pad. I'm going to go ahead and wipe off this hub here. And then I'm going to take my flush and wipe that off. So I'm going to connect this, and then I would flush. So after I flushed, I'm going to go ahead and wipe it off again. I'm going to go ahead and wipe my hub to my syringe off for my med. I'm going to connect this to the IV hub, making sure that I'm keeping it as clean as possible. Asepsis. So I'm going to push this med over 10 minutes. I'm going to watch her blood pressure, her heart rate, her vital signs, making sure that she's having a good response. Okay. I'm going to wipe this again. Wipe my flush. Connect the two. Flush that IV. Flush that med. Then I would clean this off once again, making sure we don't want any non-scomital infections. Not here. No hospital-acquired infections around here. So yeah, and then we cap that, making sure. So then obviously, before we do this, I'm gonna do my med rights. Sorry that I didn't say that before I actually did this, but I make sure that I have the correct patient, the correct time, or the correct drug, the correct time, the correct route, the correct dosage, and then afterwards I'm also going to make sure that I have the right reason, which I do have the right reason. She needs this drug, and then since I've already administered it, I'm making sure that she has the correct response to the drug. So I went ahead and charted that I assessed the IV site and that I flushed it. I said that I started the 100 mLs per hour of normal saline. I started that at 9, and I said where I started it at. I said I flushed it. I said that I started the propranolol, 10 milligrams given. I gave the route, and then I gave the time, and then I gave the time that I'm going to reassess the reassess the patient. I said husband and patient provided education on use, side effects, and expected outcomes. Education provided to husband on thyroid storm and interventions in place for treatment. Patient left in bed inside rails 3x3, family at bedside and call right in reach. Family updated on her transfer to the ICU. So since she got moved to the ICU, I'd obviously notify her family that happened. So yeah, I pushed that over 10 minutes, so I charted that as well. So now we're just gonna do some reporting off. So Miss Black is a 31-year-old female. 2 weeks postpartum, she came in, she was confused. Her husband called 911, they brought her in. She's been having watery diarrhea and generalized abdominal pain, nausea, and vomiting. She hasn't traveled anywhere. I asked if she had any drug allergies, if she had any unexpected weight loss, and then I asked for family history and if she's on any home meds. We're monitoring her vital signs and level of consciousness right now. We're monitoring her INO, and then we're also monitoring her labs and her fluid volume status. So she ended up suffering from a thyroid storm. I said that the doctor would prescribe her anti-thyroid medications and some fluids to stabilize her condition. I went ahead and administered, I have a 0.45 normal saline bag running at 100 milliliters an hour into her left peripheral IV site. I also gave 10 milligrams of enteral IV push, and she tolerated that well. I started both of those at 9 in the morning. I went ahead and checked back on her about 30 minutes later. She's tolerating this medication very well. So I told her also that her TH level came back at 0.1. So that's obviously very low. So what I'm thinking has happened is her thyroid's trying to overcompensate, which is making her overproduce the TH3 and TH4, and causing her some triggers with her Graves' disease. And since she was pregnant, that might have triggered some stuff for her going through a severe medical stressor like that. Her husband has been educated. I gave some education on the medications, obviously, and then I gave some education on what a thyroid storm was and explained the interventions that we were going to place for treatment. Just making sure that he really understands her plan of care. I already updated the family on her transfer to the ICU, so that's done. And then, so she's in bed with her side rails raised, and her husband's still at bedside with her, and her call light is in reach. Her heart rate was 145, her blood pressure was 120/76, her respirations were 32, temp of 101, and her SpO2 was 89, and she is on 4 liters of O2. So yeah, that is about it. Thank you.